Hey everyone, and welcome to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Golinvaux, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. So without further ado, let's get into this week's article titled, A Pocket Guide to Ski and Snowboard Injuries. If ski or snowboard trips are a staple of your winter activities, you've likely been in this situation. The day's going great, your confidence is up, and then out of nowhere, a patch of ice or some flat light has you on the ground and hurting. Plenty of bumps and bruises are the ones you shake off and move on from. But what about the ones that are still bothering you at lunchtime? Or they're bruised at après-ski, and it feels really good to hold on to that cold cocktail glass up against the swelling. I've got you covered. This is a pocket guide to ski and snowboard injuries. Today we'll run through how to do a quick physician's exam on yourself, what your most likely injury is based on location, and I've created a quick glance pain map of the hand and the wrist for you, and how serious each injury is likely to be. So let's get to it. This isn't med school, so let's keep it simple and get you back to your busy day. Here are 4 basic things you can work through when evaluating an injured finger, hand, or wrist. The first is visual inspection. Are there any areas of obvious bruising or swelling? Take note of where the center point of swelling is, especially within those first couple hours of the injury. 2 is motion. Can you move the injured joint? Is it painful when you move? Where do you feel the pain when you move? Meaning at the injured joint or elsewhere. Number 3 is palpation. This is where the money is. If it's unclear to you where the center point of your injury is, squeeze or push all over until you find it. It's okay to give it some force as you pinch. You'll know you found it because that center point will make you jump in discomfort. We're not interested in generalized achiness here. We want the primary, focused spot where you hurt the most. I promise this is helpful info to collect, even if it hurts. And the 4th is x-rays. This is critical to any injury I evaluate in the office. If you have any of the visual signs above, difficulty moving a body part due to pain, or a hot spot of tenderness that makes you lurch in discomfort, be sure you get to a provider who can x-ray your hand and wrist within the next few days. There are no secret substitutes for this. So let's talk about predicting injuries based on the location of your pain. So we'll go back to the palpation part I discussed above. Remember, multiple areas are likely to be sore after a big crash, but we want that single location that makes you jump out of your chair when pressed. In fact, perhaps the highest yield request I ask of every injured patient is, point for me with one finger to where it hurts the most. Now take that single worst location and plug it into the hand and wrist injury map that I made. I'll be sure to link to it in the show notes. This map is not an all-inclusive list of every last thing your pain could mean, but it's probability-based as the most likely serious injury sustained in a given location. Hopefully, you got off easier than that and just have a low-level sprain or a contusion in the area where you hurt. Now let's talk about the potential seriousness of each injury. This is where all the disclaimers have to come in. I'm not your doctor, and if you're concerned about pain in any of these areas, you need to go see a doctor. Reading about something on the internet will not save you from missing a potentially serious injury. Now that we've got that out of the way, let's try to learn something new. A boxer's fracture. I'd put this in the green or beginner ski run category. I've written about this injury before in depth, and you can access the article linked in the show notes below. But in summary, this injury happens when you punch an object, such as a hard sheet of ice when you fall on the slopes, and it results in a fracture of the 5th metacarpal bone. This bone can tolerate healing and a significant amount of deformity, often with few functional deficits. You'll want to have it looked at for x-rays and an examination to make sure your finger won't heal in a crossed over position, but other than that, these typically need a cast or a brace for only a few weeks before getting things moving with rehab. The next is a TFCC sprain. This would be in the blue category or an intermediate difficulty ski run. There are innumerable ligamentous and tendinous structures on the outside of the wrist that are easily injured from the impact of a fall or the torque of a twisting injury, such as with your ski pole. But the most commonly injured is this mouthful of a structure called the triangular fibrocartilage complex, or TFCC. Think of the TFCC as the trampoline shock absorber for your wrist. It is anchored at many points in the wrist to absorb impacts, and whether from a direct hit or a twisting injury, can be easily sprained. These injuries are mostly treatable without surgery, but that doesn't mean they heal quickly. It is not uncommon to have lingering soreness for 4 to 6 months, often requiring some guided therapy to rehab back to normal. The next injury is a distal radius fracture. This would also be a blue or intermediate ski run. This is probably the most common fracture we treat, and in regular terms is known simply as a wrist fracture. If you want to know more than you'd ever care to know, I've written several previous posts on this. The radius is one of our 2 forearm bones and is the most likely bone to break when falling on an outstretched hand. Fun fact, falling on an outstretched hand is common parlance in medical speak, and we call it a foosh, falling on an outstretched hand. The radius typically breaks near where it joins the wrist joint. These breaks come in many different patterns. If it fractures but it doesn't move out of place, it does not need surgery, but it does need 4 to 6 weeks in a cast. If it fractures and displaces significantly, surgery with a plate and screws is your path to restoring function. Regardless, these all need prompt, meaning within 1 week, evaluation with a hand specialist. Unless, of course, your arm is crooked, bleeding, or numb, please do not wait a week and kindly proceed immediately to the emergency room. The next is a thumb UCL sprain, or what we call a skier's thumb. This would also be a blue or sort of intermediate level injury. As with many of these injuries, I have previous content I have written on skier's thumb if you care to learn more. But take a look at the pain map again. Under the blue shading for skier's thumb lies a crucial ligament to hand function known as the thumb ulnar collateral ligament. We call this the UCL. This ligament links the thumb metacarpal bone to the thumb phalanx, and here's the important part. It stabilizes the thumb each time you pinch. Again, look at that map and imagine for a moment what would happen while pinching if there were no tether underneath that blue skier's thumb shading. Your thumb would just slide outward with the force from the index finger. This backstop for pinching is absolutely critical to hand function. So if you're bruised, swollen, or feel a lump under this spot after a ski or snowboard fall, please don't delay in seeing a hand surgeon. Partial injuries can be treated in a cast. Complete blowouts of that ligament need surgical repair within 3 weeks to heal most reliably. Fun fact, this is called a skier's thumb because of the unique risk that ski poles place on this ligament. The ski pole rests right in the web space between the thumb and the index finger, placing a huge weighted lever arm just beyond this ligament. It also forces the thumb out and away from the palm, making it more likely to catch on something as you fall or stick out as you hit the ground. The extra weight plus the additional exposure puts the thumb UCL squarely in the injury crosshairs of any fall while skiing. The next injury is a finger sprain or a dislocation. This would be considered a slow zone on the ski slopes. These injuries involve such a nuanced discussion that really requires an x-ray to frame the whole thing. I go deeper into that discussion in a previous post of mine as well. But essentially, these injuries are either really bad or really not, and it's very difficult to know the difference for sure without the x-ray. The joint colored yellow in the map that I made is the proximal interphalangeal, or PIP, joint. The PIP joint gets sprained all the time, as anybody who plays basketball can tell you. But as long as it's just a sprain, you can and should immediately start moving it again. Preventing re-injury and regaining motion is your key. However, it's not uncommon for these to be achy and swollen for 4 to 6 months. Yes, I said 4 to 6 months. Unfortunately, 2 much bigger injuries can masquerade as a PIP joint sprain. 1 is an unrecognized dislocation with or without a fracture, and 2 is a tendon rupture known as a central slip tendon rupture. Both of these require immediate treatment, and many of them need surgery. Ask any hand surgeon and they can tell you the disheartening stories of finger dislocations that come into our clinic 6 weeks later because, hey doc, this finger is still swollen. The next injury to discuss is a scaphoid fracture. This would be considered a double black diamond expert run on the ski slopes. Speaking of disheartening stories from hand surgeons, these next 2 injuries will fit right in. The scaphoid is one of 8 tiny little wrist bones known as carpal bones. But this one has perhaps the worst blood supply of any bone in the human body, which means that if you break it, the chances of it healing are far lower than any other bone. To make matters worse, because the bone is small, a broken scaphoid sometimes just feels like a wrist sprain for a few weeks, and many don't recognize it up front. To make matters worse again, the entire architectural support of the wrist rests on the integrity of this bone. So if it breaks and doesn't heal, your wrist will go down a very predictable path of arthritis, known as SNAC, S-N-A-C, wrist arthritis, and that stands for scaphoid non-union advanced collapse. There are entire textbooks written about this problem, but suffice it to say, don't mess around with pain in that shaded area for scaphoid fracture in the map that I made. Here's another fun fact. We call that area the anatomic snuff box, and I'm not kidding. Please get yourself to a specialist within 1 week maximum if you have pain in that area. The final injury we'll talk about today is called an SL ligament injury. This is also a double black diamond expert run. I essentially could almost copy-paste the above discussion on scaphoid fractures and substitute the term SL ligament tear. SL ligament is short for scapholunate ligament. This is a stout soft tissue band that links the scaphoid bone to its neighbor, the lunate. Just like scaphoid fractures, this ligament cannot heal on its own when it's fully ruptured. And just like scaphoid fractures, this injury often just feels like a moderate wrist sprain for a couple of weeks before it improves. And just like scaphoid fractures, the entire architecture of your wrist will collapse over time if this goes unrecognized. This time we call it slack wrist, SLAC, for scapholunate advanced collapse. So, if your wrist hurts in either of the double black diamond locations above, please do yourself a favor, be overly cautious, and get yourself in front of a specialist who can evaluate your likelihood of serious injury. So here's a few takeaways from today. Look for areas of bruising or swelling, and then squeeze around those spots to elicit maximum points of tenderness. Plug these maximum points of tenderness into the hand and wrist injury map that I made above. And finally, many injuries from a day on the mountain will be just fine, but beware, there are a few serious conditions that are lurking in the tree wells. Remember, my goal is to provide you with more and better information than you started with. No internet article can diagnose your health condition, but you can make informed decisions with the right material. Most of you will hopefully just file this away for a snowy day, but if you're actively hurting after a recent injury, be sure to seek prompt evaluation with your physician. That's all for today. Thanks for listening. See you next time.